You know, the connection between mental illness and homelessness is well known, it's been talked about, but we rarely discuss how gaining housing can transform a depressed, sick, or traumatized human into a healthy, thriving individual. Well, I spoke with some local leaders about the mental and emotional rewards that come from just having your own space and how it will benefit our society as well. I think you're going to find this interesting. I certainly did. Please watch.
When the people who are most vulnerable in a community thrive, that is actually thriving for the entire community.
Well, Savannah was not always thriving, and although the city's made great strides, there are those among us who got lost along the way. Sometimes we forget to see the homeless as our neighbors. Sometimes we forget to see them at all.
A lot of people think that they're completely separate from the average person you meet, but the average American is just one medical emergency or one bill they can't pay away from being unhoused themselves.
That financial situation is known as ALICE. That stands for Asset Limited, Income Constrained, but Employed. Jennifer DeLong is the executive director at the Savannah-Chatham Housing Authority. She says 40% of households in Chatham County are considered ALICE.
Not everyone who experiences homelessness has a mental illness or an addiction. Life happens, circumstances happen, families fall apart, divorce happens, medical traumas happen, financial crisis happens.
The Housing Authority estimates that we have about 1,000 homeless citizens in the Savannah-Chatham area. Once a person is on that downward trajectory, it becomes exponentially harder to lift themselves up.
Anyone who experiences the trauma of homelessness is experiencing a lack of mental health because they are in trauma, they're in crisis, they're in fight or flight mode. Every day is a fight for survival.
DeLong says when we offer someone shelter, we're offering them humanity. When a person feels a sense of autonomy as well as being a part of a community, they blossom.
It's a life-changing thing, and it improves everything. It improves their health, their physical health, their mental health, their emotional well-being.
A person literally can look like an entirely different person in that first 90 days, and it's amazing.
That's exactly what's happening at The Cove in downtown Savannah. It's Georgia's first approved tiny home community developed for our local heroes. It has 46 units, a tiny clinic, a veterans garden, an outdoor chapel, a pavilion, a laundry, and a landscaping project. They also offer wraparound services like transportation, job training, education, and access to healthy food, medical care, and counseling.
And that's an important part of the Housing First model, which is not just giving people housing, but also providing those wraparound services so they can have improvement in their mental health and substance abuse and other issues.
Dr. Reddick is the director of Coastal Health District, and he serves at the J.C. Lewis Clinic. He sees how the effects of getting off the streets and into a home can have on a person.
It's very seldom that I don't have a patient who's a patient of our clinic, our Healthcare for the Homeless program, that gets housing and doesn't come to me in tears.
Being here in a community, it's your ownership. It's allowing you to gain your dignity back, your personhood back. You're making choices for yourself. You lock your door at night. You decide what you want to eat. You decide what your next steps in life are.
As a community, we all worry about crime, safety, health, substance abuse, overdose, and unemployment. DeLong says the answer to many of these social issues is housing.
Housing and emergency shelter, housing and transitional shelter, housing is recovery space, housing is mental health space, housing is a single family unit, housing is single resident occupancy opportunity, housing is rentals, housing is the ability for someone exiting homelessness to purchase. It's housing. Housing is the answer.
She says solving the problem takes a partnership between private and public assistance.
It's not just the City of Savannah and Chatham County investing the dollars. It's not just HUD investing the dollars in Department of Community Affairs. No one's going to come in and save us. Our community is going to work together to have access to increased housing inventory. Housing inventory is going to affect the working as well.
As you're out enjoying our beautiful city, pay attention to our special needs neighbors and imagine a Savannah where everyone has a chance for home, health, and humanity.
Everything in society gets better when people are unhoused, and it's a shame that we allow people to still live outside on the street.
Every person deserves to live with dignity in our community. And when every person has access to a dignified living environment, we as a community can say everyone has the opportunity to thrive here in Chatham, Savannah. And I think at our granular level, that is our mandate, to ensure that all human beings have the ability to live with dignity in our communities.
Well, let's talk about the costs and benefits. There's been multiple studies, I believe 75 independent studies, that show the cost of incarceration, hospitalization, and emergency services for the homeless, that's that red line on the top, much more expensive than providing housing. So it absolutely costs money to house the homeless, but within 2 to 3 years, we start saving money as a society, and then we continue saving money, and everyone is housed. It's a win-win situation. We've got 1,000 people who need homes here. 1,000. That's it. Let's get them under a roof. We can do this if we work together. You can get more information, see our full interviews, and find a list of organizations where you can donate or volunteer. You'll find that on our website at WSAV.com. Guys?